My name is Jonna Matoizo, and this is my problem solution speech. Have you ever walked into the emergency room to be seen, only to find the waiting room packed and the wait times hours long? The strain on our emergency healthcare system can affect every single one of us, as we could be forced to wait hours for a potentially life-threatening emergency. From working in an urgent care, emergency room, and in EMS, I have seen firsthand the strain in our system. Our emergency healthcare system is overwhelmed because the strain of EMS and hospitals by non-emergent patients misusing emergency resources. For example, such as homeless people just needing a place to sleep, or someone that is drunk that needs to sleep it off till the morning. We will look at why there is a strain on our system and what can be done to change that. EMS and hospital systems across the country are being overwhelmed with the volume of patients being seen and the majority not requiring emergency care. According to ABC3340.com, posted May 9th, 2019, at UAB Hospital, 30% of ER patients could be treated by primary doctors or urgent care facilities. Primary doctors can treat many minor ailments, such as abdominal pain, migraines, and joint pain. Urgent care centers are equipped with radiology and labs within them, being able to handle many patients that would otherwise be flocking to the nearest emergency room. Patients should first consider calling their doctor or going to an urgent care before going to the emergency room, as it may be unnecessary. According to ScienceDaily.com, posted June 29th, 2019, researchers at the University of Colorado, Denver, and at the University of Kentucky found that ambulance dispatches for minor injuries like abrasions, minor burns, and muscle sprains rose by a staggering 37% in New York City. Ambulances were meant for life-threatening emergencies, such as heart attacks, strokes, and major traumas. By continually utilizing ambulances for non-life-threatening emergencies, the hospitals are being crowded by patients who could otherwise be seen at a lower level of care. Lower levels of care, such as primary cares and urgent cares, can care for non-emergent patients in the same way an emergency room can. We have looked at the problems we are currently facing. Now let's focus on the solution. By implementing community medicine programs and social work programs for frequent hospital users, we can help alleviate the amount of patients frequently calling an ambulance and reduce the number of people visiting the emergency room. According to FireRescue1.com, posted March 26, 2018, the Albuquerque Ambulance Service has reduced frequent users' utilizations in the emergency room by 70% through their community medicine program. What we see as frequent users are those that are seen at the ER multiple times a month, sometimes multiple times a week. Community medicine programs allow paramedics to assess patients with chronic illnesses in their home, allowing them to treat the patient there and educate them properly on their illness and how to better take care of themselves. These programs are possible by teaming up with hospitals and insurance companies, receiving reimbursements for keeping non-emergent patients out of the emergency room, and reducing hospital readmissions. According to Politico.com, posted December 28, 2017, Parkland Memorial Hospital created a software platform that enables the hospital to refer homeless people to shelters and pantries, and let social workers see if their clients are filling prescriptions, getting healthy food, or having a place to sleep. By having a social work program like this, allows social workers to do more outside the confines of the hospital, helping to assure these patients won't have to continually return. A social work program like this is attainable as it helps alleviate costs to hospitals by frequent flyers, returning to the emergency room for non-medical issues such as just needing a place to sleep. In conclusion, the problems in our emergency healthcare system can affect us all. However, by implementing solutions in our community, we could work to fix that. Today, we have seen the strain on our emergency healthcare system through the misuse of emergency resources both in the community and in the hospital. Our current health pandemic has kept people at home, making many rethink what an actual medical emergency is. With everything we see in life, every problem has a solution. We continue to see the problem of full emergency rooms and waiting areas packed to the door and out the side of the building. However, with community medicine programs and social work programs, we can help frequent emergency room visitors at home. By minimizing the strain on our emergency healthcare system, you hopefully will never have to wait a long time for your own medical emergency again.